60-year-old lady from out of state presents with uh, basically imaging that she had for a cardiac workup that incidentally showed what was a rupture of the left breast implant. And so she comes in with the many signs and symptoms of breast implant illness with a known ruptured implant. Interestingly, she never had any subsequent workup with an MRI. So she sought me out, and as you will see, 100% total capsulectomy was done, 6/25/24, initials SS. I cut out the excess skin because she had what was significant bottoming out, some thin capsule here, and as I dissect, she had what was silicone intact implant on this side. That's from 2010. So this was fairly recent, this 2010, so 10 years ago. And as you will see, there's some fluid around. If I go get this fluid, you will see this gummy sign, if you will, that stickiness. This is consistent with that gel bleed. So this is your intact Mentor 475 cc implant. And you can see overall it's intact and a capsular tissue that is very much relatively very thin and complete capsule removal. Now the Facebook Live is done to show that look, this is just 10 years old. And as I was dissecting, I'm going to go ahead and remove my top glove. As I was dissecting, you can see if I hold this out, as I was dissecting, this is how the implant was sitting. Now you will see it protrude out here. You will see how it's going to protrude out here, right? And all that end block. So there's no spillage. There's no break in the capsule. And you will see this outpouching right here. See, look, it goes like this. It's kind of like an aneurysm, if you will. It goes like this and outpouching. And what I'm going to do is here's another outpouching. So it doesn't take much to break this capsule and out falls the silicone. And the other thing I want to show, which is very important, look, this is the part that was against the chest, like this. And it was done very meticulously. You can see how it's kind of not confined like an intact implant, not round and circular. It's protruding out. You can see some areas very thin. And look at this area. And then if you look carefully, this hard part is the cartilage of the rib. This is the rib, and the implant was sitting very tightly, securely. And so I had to remove this in order for me to not cut into something like this and would allow for the silicone to spill into the chest. So the whole goal is to the surgery in the end block fashion, 100% total capsulectomy. So none of this spills into the chest. So what I'm going to do is I'm actually going to go in from here, from the rib area. Actually, let me go in from here. I want to go ahead and show this. So I'm going to dissect this out. Remember, this tissue is all bad too. So I'm going to go here to show, and I'm going to dissect this area out. Look how protuberant this is, right? How so this tissue around is bad. It has to go. So look at this outpouching, if you will, right here. And I actually got into it right here very briefly. So as I go in, lo and behold, just like the cardiac imaging picked it up incidentally, this is your ruptured implant. None of this fell into the chest. Let me just go put this here. And it's completely, this is supposed to be the nicer, better, more cohesive gummy bear. I can drive my F-150 over it implant. And I'll tell you, this is completely disintegrated. None of this spilled into the chest. And what I would say, not a safe implant. I removed implants last Thursday from 1972. These were 52-year-old implants. Those were much better than this cohesive gummy bear gel implant, and you can see completely disintegrated, and you can see the capsular tissue. The silicone has literally disintegrated, all contained by the capsule. So it is important to do this end block. Again, this is the second ruptured implant that I've done. One was from earlier today, just a few hours ago, from 2009. This one is from 2014. And you can see some areas are so thin. If I put it on top of a ruler, you can actually read through it. So these are not the safer, better, cohesive gummy bear. Look at this. This is not a gummy bear. And so the end block is the gold standard. And this is how I do it. Number one, no need for a lift at this time. Actually, she's going to do very well looking at her 60-year-old age and the excess skin that are removed, such that she will basically have a good recoil. No need for drains. The blood loss was less than 5 cc's. Number three, the cultures will be sent for Arabic, anaerobic, and fungal. The capsules will be sent to pathology, rule out the BIA, LCL, CD30 analysis, rule out BIA, SCC, which is BIA, breast implant associated squamous cell cancer, breast cancer, anything abnormal. And then number five, I've done pictures, high definition of the chest showing complete removal. Number six, twilight sedation, and every patient gets pretty much the same surgery, regardless of age, regardless of rupture or not. And one has to always go in as the surgeon thinking that they're ruptured to proven otherwise. And this is where the entire end block procedure is done definitively, sincerely, such that none of the silicone spills into the chest. If you can imagine, if this spills into the chest, there is no way how much washout you do, how long you have the drains. It is going to continue to cause the silicone toxicity, silicone granulomas. And believe it or not, this is very interesting, and I will show you. They actually wanted to do a biopsy of this so as to completely determine what the etiology of the calcifications were. So there you have it. This is Dr. Khan, Executive Plastic Surgery.